SGLT2 inhibitors are an exciting new class of drugs. One of the most two findings that have really been, I think, an important aspect to changing the way we think about caring for people with diabetes. First was the EMPA-REG study, which was a cardiovascular safety study with empagliflozin. And what they found was they were looking to see just if the drug was safe, but it turned out not only was it safe, but it actually lowered cardiovascular risk significantly. That then brought up the question, was this specific to that one analog, or could it be part of a class effect of the SGLT2 inhibitors? And the study that helped to look at that was a retrospective study that was presented at the American College of Cardiology, CVD Real. And what they did is they looked at a large data set and identified that those patients that were on SGLT2 inhibitors had a significantly lower risk of hospitalizations for congestive heart failure. Now you have a drug for diabetes that not only improves blood glucose control, decreases cardiovascular mortality, but also decreases hospitalizations for congestive heart failure, a very high cost event in managing patients. And so I think understanding the other added benefits of this class of drugs really makes us think of it much earlier in the armamentarium for the management of diabetes.
So one of the most exciting things to come out of the American College of Cardiology meeting that we held about a week ago was the Fourier trial, which used a new drug, a PCSK9 inhibitor, which is a novel way to lower LDL cholesterol. It's much more effective than the statins and the standard ways we lower LDL cholesterol. This was a study that was done on top of statin use. So these patients had a 15% reduction in the primary outcome of the trial, which was a composite primary outcome, what we would call MACE+. And it's very exciting because it suggests that if we can lower LDL further, we can lower risk in these patients even further. Unfortunately, these drugs are also expensive, and they're going not to be first line in patients with coronary artery disease or at risk, but they're going to be I think niche drugs for a while. Tsukuba Valsartan is a angiotensin receptor neprilysin inhibitor that in the Paradigm-HF trial was shown to significantly reduce cardiovascular death, heart failure, hospitalization, and all-cause mortality. We recently did a post-hoc analysis from the Paradigm-HF trial looking at the effect of Tsukuba Valsartan on glycemic control, specifically hemoglobin A1C. And we found somewhat unexpectedly that there was a highly significant reduction in hemoglobin A1C in the patients who received Tsukuba Valsartan compared to those who received enalapril. It wasn't an extremely large effect in magnitude, but it was highly significant. It was about 0.2 overall points of hemoglobin A1C. But what was actually even more important was that there was a 30% reduction in the percentage of patients who got started on insulin who were diabetic in the trial. And that's important if you think about treating patients with diabetes and heart failure. We want to make sure that what we're doing for their heart failure isn't going to make their diabetes worse. And what we think with Tsukuba Valsartan, that if anything, we were improving glycemic control and we were reducing the likelihood that they would need a new anti-diabetic medication like insulin.